Good day and welcome to another webinar in our IISC Performance Excellence series. We've been doing these webinars for the past 3-4 years and they've been very successful. I think our members and customers of IISC, the Institute of Industrial and Systems Engineers, have very much valued these. This is one of 4 webinars in a mini-series focused on operational analytics. And I'm pleased to be joined today with Andre Pena and Michael Cesar from the University Health Network in Toronto, Canada. I've got a couple of slides I want to go through at the front end just to tee things up, and then I'll pass the baton to those gentlemen. I'm really excited about this webinar in particular. I have a real passion for finding organizations that are exemplary, that are doing cutting edge things that really represent excellence. And I think University Health Network, particularly their data strategy, governance, analytics work, is in fact that. So I'm excited about today. I'm going to do a tee up. Michael and Andre are then going to spend about 30 to 40 minutes with you, sharing their insights and experiences, and then at the tail end, time permitting, we'll do some Q&A. We'll dialogue a little bit with them, and then I'll close out and give you an overview of what's ahead in July and August. A couple of housekeeping things, items. So one, thanks for joining. I know you're all busy. And I know some of you are from different parts of the world, so this isn't probably perfect timing for you. So I appreciate you being willing to do this in off hours for some of you. We are recording the presentations, and you will see. We'll provide you with links in terms of where you can go to find both the recording and the PowerPoint presentations, and we'll be chatting those links with you. So if you use the chat function to share comments and questions, but also to just monitor linkages that we're going to share with you that'll help you do follow-up work from the webinar itself. For those of you that value certificates of participation, IISC will mail those out about a week after the webinar. And so this is, as I mentioned, we've been doing a number of mini-series, 3 to 4 webinars that are all related to a particular topic. In the fall of 2022, we did a webinar series on what I call strategies for riding the waves of disruption. So heading into what we figured was going to be a rocky and rough 2023, we had a number of speakers that shared their insights around how to batten down the hatches and sort of weather the economic storm and battle against some of those economic headwinds. And then we did a 3-part series on supply chain management 4.0 and 5.0. And this is, as I mentioned, this is one of 4 webinars in operational analytics. And the next mini series just ahead is going to be focused on AI. And I know that's a topic that's of interest to a lot of people. So our intention with the AI webinar is to basically talk through sense making. So how do we make sense of all this AI stuff? And so we're going to provide you with ISE perspectives and points of view on artificial intelligence, specifically as it relates to how do we practically and pragmatically apply it in the domain of organizational and process excellence. All of our series of mini-series of webinars have culminated in a feature article in the ISE magazine back in December of 2022, as I mentioned. Resilience for the new roaring 20s was discussed, and then the supply chain. And in August, in early August, just around the corner here, you'll see a feature article that summarizes the operational analytic mini-series. So look for that. All of these webinars are located on demand on the IISC website. You'll see these are the buckets that they're placed in. So this specific webinar will be in that operational analytics bucket. Down there in the lower right-hand corner is how to get to that link. So you'll be able to find this webinar. We've done a number of webinars in healthcare. We looked at the Ohio State University Med Center, and we did a flow workshop case study webinar, very interesting webinar. So healthcare and life sciences has been a focus over the past couple of years with us. You can also go to the Poirier Group website, and you can find these webinars in shorter form, like 14-minute versions, and you can also find them on YouTube, and these links will take you to those spots. So as I mentioned, this is Operational Analytics 401. It's the fourth webinar in the series. And now I'll pass the baton to Michael and Andre and let them welcome them to all of you. And they've got a short introduction they'll do of each for both of them. And Michael and Andre, thanks very much for taking time to do this today. Very much appreciate it. Thank you.
Wonderful. Thanks, Scott. And so happy to be here and excited. And thanks to you, Scott, for thinking about us north of the border. We're from Canada, as you've mentioned, and really always appreciate coming down and being able to share what we're doing. And thank you to the ISE group in sponsoring this, as well as the Poirier Group in helping us, provide an opportunity for us to share some of the things we're doing. So really appreciate it, and thank you so much. And thank you for everybody who's joining the international audience that we have here today. Wonderful to chat with you, and we will get started. We'll see if I can change the slides here. There we go. Okay. So thanks. And as Scott mentioned, I'm Michael Caesar. I'm the Chief Data and Analytics Officer for University and Health Network. I won't spend too much time talking about us as an organization because I've got a few slides that introduce us. But essentially, I'm the lead for the Data and Analytics Group here at the hospital. Really, our mission and our goal is to help UHN see and understand and use data better. And we have a whole bunch of ways we do that, and very exciting ways that we enable that. And I'll hand it over to Andre to briefly introduce, and then we'll launch into some of the presentation.
Thank you, Michael and Scott. Good morning, everyone. My name is Andre De Pena. I am the Director for Data Strategy, Governance, and Analytics here at UHN, working closely with Michael and my team responsible for establishing and advancing data governance at UHN, improving our data literacy skills across the organization, and of course, applying analytics to address some of the healthcare challenges facing us.
Wonderful. Thanks, Andre. And a pleasure to be presenting with you today. So we'll get started, and as I said, I'm going to provide a bit of overview of UHN, but really, essentially, the presentation that we're going to go through is that I'm going to talk a little bit about our strategy as a whole from an organization perspective, and how we fit into that strategy and how we align and see ourselves enabling that strategy. I'm going to talk a little bit about our operating model and the way we look at the world around organizing ourselves, and how we support the organization and what we do and how we think about that. And then Andre is going to talk about some critical skill sets that we have in our organization and roles that we have enabling that, and then round us out with some use cases, some of the exciting things that we've done over the last year or so. So we'll get going on that. So first off, those of you who don't know, University Health Networks is a large academic health sciences center in Toronto, Canada. We're Canada's largest research hospital. And I won't go through all of these statistics here that you see, but those of you who are keeping track and understand and see other healthcare organizations, you'll see that we're serving, we see over 1 million outpatient visits. At any given time, we have 500,000 active patients that we're treating. So tons of data flowing into our organization. And we serve, the patients that we serve are in arthritis and neuroscience and cancer and cardiac and surgery program. We have North America's largest transplant program as well. So very proud to be part of this organization. And we do lots of great work for our patients and our communities at large. And when we look at UHN as a whole, this is our strategy and what we're tracking towards as an entire organization. And when we go around the block here with all of the colored dots, some of the things stick out around building our workforce, and that's called Team UHN. And how do we advance that workforce and make sure that we're enabling them to do the best work they possibly can and provide the best care they possibly can. The next one is around convergence of care and research education. We have a three-legged stool here at UHN where we teach and we do research and we provide clinical care. And so how do all those three work together, and how do they converge to enable us to do the best work we possibly can? The green one is around unleash the power of technology and innovation. Of course, how do we use technology and innovation to develop new care models and empower our care providers and our patients to receive better care? Of course, we want to elevate Canada as a world destination for commercialization and discovery and attract the best and the brightest to our organization and to the country. And lastly, we want to inspire and invent tomorrow's care, develop new care models, new treatments, new diagnostic tests and technologies, and we actively work on all of those. And so from a data and analytics, zooming in a little bit, from a data and analytics perspective, and the group that Andre and I lead and others, we see ourselves as supporting all of that work. And as I said, we support the seeing, understanding, and using data to create a healthier world. And really, there's three major functions that we do. One is a data operations, which is a core function around managing our data, bringing in standards, building the storage and the data pipelines, and understanding ontologies, and managing the quality in the data lifecycle. We have teams and experts who do all of that, and they are side by side with our re-engineering the decision-making group. And that's a group who is surfacing the data, surfacing the analytics, and supporting our organization, seeing things differently, helping them make decisions that are data-driven, informed, as Andre mentioned, being data literate, understanding what the data is telling them, and being able to advance our organization through data. And then lastly, we're partners in change. Data alone doesn't drive change. We need to be partners. We need to understand the business of healthcare. We need to understand the business of delivering healthcare and our patients and our care providers. And we work side by side with them around process redesign, around understanding and defining problems that need to be solved, understanding drivers of those problems, opportunities for improvement, and all of those things. And so we have a team that goes in and helps and works side by side with those individuals on the executive teams and the clinical programs, as well as the improvement teams, to help them advance the work that they do. So if we back to the original strategy, I won't go through all of these bullets in detail, but you can see that you'll recall the colored dots. Those are the organizational strategy. And it's really important for us to be tightly aligned with the strategy. We feel, as the Data and Analytics Group, we're a core enabler of the strategy, and we need to support that work in all that we do. And these are some examples of the things that we do, enabling data-driven decision-making across the organization, bringing in a data architecture that supports all of that work, data literacy and helping the organization understand and use the data, helping the organization through data to invent new care models, to test care models, to evaluate new care pathways for our patients, and finally develop partnerships that enable us to leverage expertise not only from within our organization, but outside of our organization around analytics and AI, and be able to create those partnerships that leapfrog us in our organization. And when we tie all that together, and when we think about us as a department in the organization, this here is our strategy. And we think about the broader organization, but what are we actually working on? And of course, our tagline is enabling insight, and I'll repeat it now: see, understand, and use its data. But the areas of focus that we work on, we can't work on everything. And so we've worked with the organization to refine and define the areas that we want to work on. And those are those 4 areas called the areas of focus. Quality and safety. So how do we make sure that we're delivering quality care? How can we measure that quality in care? How can we see for opportunities, surface opportunities for improvement, and enable those focused efforts for improvement in quality in the safety realm? Second is around variation of care and utilization. How do we help the organization see unnecessary variation? How do we partner with them to build operational efficiencies and eliminate waste in all of our care services across the organization? The next one is the care equity and models of care. And really that's about how do we make sure that we can see the patients and the populations that we serve, ensure that they're getting served, and supporting the marginalized populations in our community, and identify and define new models of care and new care pathways that support them in better ways than they have before, and using data to do so. And lastly, and COVID has surfaced this one significantly, is around our workforce, and understanding our workforce, understanding the characteristics of our workforce, our well-being. There's a lot of dialogue right now around burnout in healthcare. And so how do we use data to support our better understanding of our workforce and enable us to retain and attract the best and the brightest? And very quickly along the bottom, the strategic underpinnings, how we're doing that is in 4 areas. One is around our data architecture and what we're calling a unified data framework. How do we bring that technology and architecture together to enable us to access that data in a consistent, reliable, high quality way? How do we bring together our data governance and information governance that allows us to manage that and control that, where we need to protect it from a privacy perspective, but also put it in the hands of the people who need it to make better decisions and support the organization? Data and analytics and literacy, how do we teach the organization to use the data and understand the data to drive better decisions and see opportunities for improvement? And of course, our data operations is critically important, and the machinery that allows us to do that. And that supports our ability to bring decision intelligence to the forefront, to do advanced analytics and enable the organization to get better insight, and of course, see our overall performance of the organization and how we're doing in the delivery of care and supporting our patients. So when we think at UHN about what is a data-driven organization, we've used this framework, and I appreciate the font might be a little bit small, but I'll sort of try and characterize what it is. We think about it from an input-output perspective. So on the left-hand side, we have multiple data supplies that are occurring in our organization, and they're getting more and more every single day. We have our electronic health records. We are now starting to put sensors and watches on patients and monitoring their vitals. We have a lot of patient-generated data through focus groups and through feedback forms and through patient experience surveys and through our web and social media. Patients are giving us feedback. We've got smart machines, smart pumps that are collecting data every single second around what's going on with the patient and the environment. And lastly, all of our data around our operational performance and how we're delivering care. And on the right-hand side is where the demand lives. And the demand from the organization is around building personalized healthcare. How do we start to build treatments and diagnosis that are personalized to the patient and supportive of the unique characteristics of those patients? How are we building non-traditional care environments? Not all care in the future is going to be delivered in the hospital. And so how do we start to build new care pathways and new non-traditional care environments like hospital at home and other community partners that enable us to deliver care just as well, if not better, than what we do in the hospital? How do we enable predictive medicine, enable AI to support our ability to see and predict the delivery of care, see and predict trajectories of diseases, and so on? How do we support our population? How do we better see our population and support them in terms of disease prevention, chronic disease management, and partner with our communities and our population in our catchment area? And lastly, how do we make sure that we're delivering efficient and optimized care? And so those are the two ends of the spectrum. And in the middle is what we call a data-driven organization. And so how do you take all of that data on the left-hand side and enable it to be productive and value add on the right-hand side? And so we think that that middle piece is what we do, and we support the organization, and we enable the organization to do better at moving from all of this raw data that comes in the left to enable where we want to get to on the right. And so when we think about that and why does it matter? So data and analytics, everybody has access to data. We just use it and drive and improve the solutions. When we think about all of those things that we want to improve, efficiency and driving new non-traditional care environments and population health, predictive and AI, there's things that hold us back. And in our organization, there's things that hold us back around access to the data and our fragmented data, our siloed data, and our maybe variable quality of data. our ability to apply analytics and support our organization and driving insight and seeing opportunities for improvement, inconsistency around results and access to data and who's able to calculate and who has the best understanding and a support of the analytics to enable the organization to see what's going on. And sometimes we have inconsistency there. And then ultimately leading to slow decisions that lessen the impact of our ability to drive change and more immediate and fast-paced change in the organization. And lastly, when we think about this, as I've sort of led up to, it's more than just data, of course. And we have data as the supply, and we need to put structure around it. We need to put governance around it. We need to put analytics. But at the end of the day, it's around the value and what we're driving change in the organization and how we're supporting the organization and seeing improvement, how we're supporting the organization, prioritizing that improvement, and how we're enabling the organization to use its data to make better decisions and see things differently than it never did before, and invent new ways of delivering care that has ever been done before. And so that's the way that we see the organization. That's the way we see data and analytics and support. And so I'm going to change gears a little bit and move into our operating model and the way that we're starting to build and think through what our operating model needs to look like. Okay, so when we think of driving change and supporting the organization, there's sort of 5 things that we think about. I'm going to do a deep dive on the operating model today, but of course we need vision and leadership. We need the North Star. What are we trying to achieve? I've already mentioned around helping prioritize improvement, helping drive improvement, and helping measure improvement. And that's all part of that North Star. But what are we trying to achieve? Part of that's about the strategy, and part of that's about our broader priorities within the organization, operationally or strategic. Of course, there needs to be business value, governance, and policies to support that work, operating model, which I'm going to do a deep dive on, and of course, the technology that supports it. That can be data technology, data architecture, but also applications and systems in the organization that help us interchange data and support our continuum of care through technology. And when we look at the organization from an execution of strategy, so I've shared with you our organizational strategy and where we're trying to get to. We think about where those organizational objectives are, and I've shared with some of you around variation of care and quality and safety and our workforce. How do we execute on that? And really, it's starting to get down into how we support our portfolio management structures, our program management structures, our project management structures, and how all of those are built together to allow us to drive the change, use the data, drive the change, and support the organization in where it's going. And I'm going to shift gears now into our operating model, which supports this structure, as well as the 5 fundamental pillars for change. This is the operating model we think about. This was written up in a paper in Healthcare Quarterly a couple of years ago. And really, it's about the data and analytics organization and how do we need to structure ourselves to support the delivery of the strategy, support the prioritization, and support our ability to improve going forward. And really, it's about a center of gravity from the organization to see and understand how to interact with data and analytics. It's an ability for us internally to work with each other. And I've used the term north, south, east, west. So how do we work vertically within this structure and horizontally within this structure? And how do we develop that capability and capacity in our organization and our department to support what the organization needs in terms of analytics and data governance and data engineering and AI and literacy and all of those elements? We also provide the governance and oversight that's required for managing our data and for providing access to our data, and ultimately being responsive. So when strategic is pulling us forward or operations is pulling us forward, we need to make sure that we can organize ourselves to be responsive and deliver the value that the organization is expecting. And so I'm going to go through each layer, and then I'm going to talk about how they interact with each other very briefly, and then I'll hand it over to Andre to talk about some of the roles. So these are the components. They're fairly straightforward. And really on the top left-hand side, we've got, the data technology and operations, and that's the data architecture. That's the technology that we have in place that allows us to collect and manage, store, and provide access to the data, enabling the flow and the data pipelines that need to be created to allow the data to move throughout our organization and get to the people who need to get to. That's a critical function, highly technology-based, and we need to build that and support that within our organization. The next layer up is around our data and information governance. This is enabling policy and procedures to allow us to effectively manage our data across the organization, put principles in place, and allow us to build standards, see quality, and make sure that we are managing those strategic assets as best as we possibly can, and advancing and moving forward with the organization as it needs to. The next is change and automation. This is the layer that starts to use the data to support the organization. And change and automation is using the data to support the organization in driving change, as I've mentioned, to support its priorities and implementation, as well as automate some processes. So there's a lot of processes out there that we could automate, and we could use AI or some other technologies to allow for different ways to get the work done. And the reality is that's a change management exercise. And we need to redesign processes and support the organization in doing things differently in that space. Down on the bottom left-hand side, we've got the advanced analytics and insight. And of course, that's using the data to drive insight and bring the analytics to bear, generate novel ways of algorithms coming into play, and AI, and machine learning and other things that help us explore and understand a problem and potentially solve the problem. Down in the middle bottom is the literacy, is around teaching the organization how to see and understand the data, how to use the data, what it means, definitions, and really empowering the organization to be more data-driven in the organization. And lastly is the strategy and relationship management, which is about championing the use of data across the organization, building those partnerships with the clinical programs across the organization to help support them in the use and understanding of the data, and being partners with them to help them understand the potential, the art of the possible with analytics, and supporting them making better decisions across the organization. And so lastly, slide changes. Lastly, the interactions amongst these layers. So it's not just the layers operating independently, there needs to be interactions with them. And when we think of very top left, we think of the strategy and the relationship management and that partnership element, the change management and the advanced analytics. This is all about prioritization. Where does the organization want to improve, and how do we align our resources to make sure that they're well supported in the improvement? There's an announcement going off in my office, and I might have to mute in a second. I'm at the hospital. Apologies for that. I am on site at the hospital today, and it never fails that an announcement goes off during a presentation. So this top left-hand group is about that prioritizing investment, and how does the organization provide us input to allow us to prioritize our capacity and our resources and our investment to support the organization in what it wants to do and strategically advance. The top right-hand side is the change automation, advanced analytics, and analytics literacy. And this is about the people and the culture, and how do we start to build and advance our culture to use data to drive change, understand process improvement, understand process redesign, and use different tools in those processes like AI, maybe some algorithms, to help us make decisions or have a human machine adjacency to drive a process. And that interaction across that horizontal is what does that. Very bottom left is around risk tolerance and strategy. So the strategy is going to advance. I apologize, there's another announcement in my office. Apologies. The bottom left is around risk tolerance, and the strategy is going to push our risk tolerance. They are going to advance us and make us move into uncomfortable places. And we need an interaction between understanding where the organization wants to go and the data governance. And so how can we align our policies and procedures to help the organization achieve and assess its risk tolerance moving forward? So that's the interaction between those layers. And then lastly is the interaction between the advanced analytics and insight and the data technology and operations. The advanced analytics and insight are going to develop new tools and new ways of thinking about things and new ways of building algorithms that's going to drive and change our needs for our data architecture and how those linkages come together. And there needs to be an interaction so the data technology and operations can keep pace and make sure that they're continuing to build what they need to build to support the advanced analytics group in moving forward and supporting the organization. So that's the operating model and the way we think about how we need to structure ourselves. We're still building a lot of this work, but that's our initial position around where we're going. And we've got a lot of these pieces in place. I will hand it over to Andre, who's going to talk about some profiles and some use cases that has lit up some of this work that I've just described from a strategy and operating model perspective. So Andre, over to you. Thank you.
Thank you, Michael. So as Michael just shared our analytics strategy with you and also the value we aspire to provide, in order to realize this value and achieve our strategic objectives, we clearly understood the importance of enabling the right roles within our teams in order to unlock the value and potential of our data. So yes, we have directors, we have managers, we have project managers, but we'd like to highlight 3 different roles that we think play a critical part in enabling our organization, as Michael mentioned, to help us see, understand, and use our data differently. So the first one I wanted to highlight is what we call our decision support analyst. And these are our resident experts in informatics. So they help our organization understand how we perform as a hospital, understand our accreditation requirements and how we are funded, and also helping the organization to understand how we can use our data to continue that accreditation, to continue improving our performance. They tend to be experts in large healthcare data sets and using those to make decisions and help people inform their decisions. They're comfortable with medical terminology, they're proficient in informatics, health informatics especially, and they're comfortable with the technology that we use. So Michael mentioned our new EMR, which is Epic, but they're also comfortable using business intelligence skills and statistical analysis to be able to create the right reports to help understand how we are performing as an organization. One example, as I mentioned, is accreditation. So stroke accreditation is something that we need to maintain in order to provide the right services for our patients. But you can also look at another example that we have here, which is making sure that our clinicians and medical staff have the right blood group confirmation when they're working with patients to make sure that our patients get the right blood resources and services that they require. The second role we'd like to highlight is that of the analytics consultant. And so these are individuals that leverage our data assets very creatively and innovatively to create analytic solutions that solve a lot of the healthcare challenges that we face, whether it's with our hospital operations, or with our workforce, or with improving our actual patient care that we provide. And they have a background in simulations, predictive analytics, some operations research. A lot of them are industrial engineering employees, professionals, but they're also confident and competent in project management and change management. And we'll go through some of these examples further down in the slides, but a couple that I wanted to highlight in terms of examples of what our analytics consultants work on is, for example, they've created an emergency department forecasting model that actually looks at how many patients are we expecting to see by day and broken down by shift, but also based on their acuity and the level of care that they would require when they come into the emergency department. And that helps us inform the type of staffing that we would provide. So someone who comes in with a simple bruise or cut, probably your nurse practitioner could help them. But if there's someone who comes in as an accident victim, they probably need their services of a physician or a physician assistant. And so knowing what they're coming in with and how many of them will come in by hour and by shift, we can plan in advance around the short staffing that we have at the moment in our hospitals. The third example that I wanted to share with you is that of the data storyteller. So this is a really new role that we find has been creating a lot of value in the organization. And these are individuals who can take complex data, really complex issues and challenges and break them down into a really robust narrative and almost tell stories with the data that can help inform the decisions that executives, for example, need to make to improve care. They're experts and very savvy in data visualization techniques, also in the architecture behind the scenes, because they have to know how to mine the data and the right data sets and how to stitch those together in order to tell those stories and create those products or reports or visuals that will help with the decision-making for the clinicians, for physicians, and for our executive staff. And they've also been able to create, dashboards. So for example, we have a COVID-19 vaccine registry dashboard that helped the executives identify and prioritize the eligible groups of population that we serve that would space them out in terms of and prioritize them in terms of their vaccination dosages. They've also created wait time information screens in the emergency department that inform our patients on how long they would expect to wait before they're seen by a physician. And these are also available on our website so that patients can know in advance if they should go to our emergency department at the Western or at the Toronto General Hospital or another one, depending on the seriousness of the care that they would like. Now that we've seen just a couple of or three of the different roles that we have that are relatively innovative and that we find great value in the organization, I wanted to spend a little bit of time to walk you through a few examples. And this ties in very nicely to some of the industrial engineering principles that we've used to show you the innovative use of data and analytics in a healthcare setting, but also to show you our strategy in action, right? And so showing you how our operating model is actually creating sustainable or scalable value at the end of the day for our organization. So the first one I'd like to walk you through is the first COVID-19 vaccine clinic that we created. And so in the second wave of the COVID pandemic, back in December of 2020, the government came to us to very quickly, in a short span of 3 weeks or 4 weeks, start to design and implement Canada's first COVID-19 vaccine clinic to administer dosages of the new vaccine that we had. And so we had a unique opportunity to apply a number of different industrial engineering principles in order to inform this pilot clinic, as well as the long-term vaccine administration policies and decisions that we needed to make as a healthcare system. So everything from, starting with the process mapping that we needed to do in order to learn from our previous flu vaccine clinics that we had done, but looking at the workflow and the process and mapping that out from both a staffing perspective as well as a patient flow perspective. And then we applied queuing theory to help us understand, whether we can use defined distributions, determine what the right patient arrival rates would be that we could appropriately service in terms of the dosages, how many could we actually do? And then we also included the simulation aspect into the workflow to make sure that we were reducing waste, identifying bottlenecks, if any, across the workflow, and identifying the right number of stations that we needed to administer the doses and which types of staff would be needed at each stage, a pharmacist versus a nurse versus perhaps a registration admission clerk. We also conducted a lot of observational time studies across the 3 clinics that we put in place for the first few months of that particular wave, and did a number of optimization initiatives based on those observational studies to improve the flow of patients, but also the flow of the workflow and clinical flow of the staff. And then we also did a lot of scenario testing. So we wanted to see how we could optimize the clinic in terms of, again, setting up all of the different stations and aspects, but we looked at, again, minimizing waste, but also making sure that we never ever had a steady flow of vaccines in the early days of the vaccine administration. And so looking at optimizing for every single aspect and every single scenario that we faced and learning from that by using these industrial engineering principles. So that actually provided a lot of great value to our patients and to our staff using data and analytics and NIE. The second example that I wanted to talk about is inpatient bed capacity planning. And so our patient flow team here at UHN looks at the entire patient flow from when a patient comes into the hospital, either to the emergency department or when they're admitted directly onto an inpatient unit, all the way to when they're discharged from our care after their stay in the hospital. And as the pandemic started to ease and as we started to ramp back up in terms of our clinical activity, we quickly realized that we had a Herculean task of going through surgical wait lists and backlog of patients waiting for surgeries. And so we reached out to our colleagues at the University of Toronto Mechanical and Industrial Engineering Department, specifically Dr. Mike Carter and Carolyn Busby, and they had created a general hospital simulation model. We took that model and then fit that to our Toronto General Hospital so that we could actually look at if we were looking to increase the throughput of patients through the system and have more surgeries so that we could reduce the backlog, what would that look like in terms of the other resources that we need in the post-anesthesia or perioperative services? What would that look like in terms of the number of beds that we would need on the surgical units, but also in the other general internal medicine units? How would the off-servicing of patients look like if we had too many patients and not enough beds in that particular service? And so these models helped us to make medium-term as well as longer-term decisions about how we come out of the pandemic and still ensure optimal quality of care for our patients. The last example that I wanted to share with you is around the eating disorders program. And this is an example of optimization work, so clinical optimization, workflow optimization. Over the pandemic, again, the number of people experiencing eating disorders drastically increased, unfortunately. And our clinic was closed because we were facing a shortage of staff, which was a global phenomenon for healthcare resources, as Michael talked about the burnout as well. So this referral list of patients being referred in by their family physicians just started to increase. And this overwhelmed the mental health program within UHN, and especially the eating disorders program. There were a number of patients waiting to be referred in, to be seen for individual therapy, group therapy, for inpatient services as well as outpatient services. And so we developed two different models for them to actually use. One was a resource utilization model so they could use the scarce resources that they had and determine how long it would take them to actually work through that backlog and what would that optimal mix of staffing look like between dietitians, nurse practitioners, physicians, psychologists, and psychiatrists. And the other piece that we helped them was to build a dashboard that would actually provide them visibility into their operating performance. So they could actually see how they were performing, again, identify any bottlenecks and make improvements against any benchmarks that our province of Ontario has around healthcare in the mental health space and eating disorders, but also in terms of their peers, and solely also to look at improving the services for these patients who needed urgent care. So that's another example of how we've used our existing data assets and applied analytics and industrial engineering principles to improve the value for our business clients, which in this case happens to be our patients and our staff. And I'll pass it back over to Michael now to close out this presentation for today.
Well, thanks, Andre. So this is last slide, and just really a time to put some things on the table that we continue to think about. And continue to be challenges for us and opportunities for us moving forward. And so really there's four down at the bottom there. And one is around decision science, and how can we continue to bring forward tools and techniques that support our organization in making better decisions and seeing opportunities for improvement and designing new ways of doing things. And so you've seen some examples of where we've done that, but that's a snapshot, and there's so many opportunities. And so the question for us is, how do we continue to get better at that? And how do we start to introduce new and better ways to support our organization and change their behaviors and drive process improvement and design new models of care? The second one is around data fidelity. And this is about the data that we're collecting. You'll remember the supply and demand chart that I showed early on, where we're collecting a lot of data, and that data is only useful if we can use it, and it's only useful if it's of high quality and it's available, and we've got the right policies in place for sharing and other things. And we have that's a continued work for us. In ensuring that, developing policies, developing structures, building technology that allows and supports that work. And so how do we continue to charge forward in the next 5, 10, 20 years to get better and better at that? The third one is around risk. And we've talked a little bit about risk and how our operating model helps balance risk and charge things forward. But the reality is, and I know, Scott, you mentioned early on in your introductions that you've got AI and some other things on plate. The reality is ChatGPT and some other AI technologies that are coming down the pipe are going to challenge our risk tolerance. And they're going to bring new ways of doing things into play that are going to potentially turn upside down the way we've gotten work done in the past. Mm-hmm. And so how do we continue to support our organization to see and understand our risk tolerance, and know how to test that and move it forward as needed? And then lastly, and Andre mentioned this in his intro, and Andre spent a lot of work around data literacy, but this is about, it can't be about us alone. Data and analytics is a team sport. And how do we enable the entire organization, and not only the entire organization, but also our community around us, to become more data-driven and to use the data that they have and enable themselves? That's the only way we're going to scale up and enable us to be data-driven, to see opportunities, see a problem, fix a problem with data. And so how do we continue to do that? How do we continue to invest in those things? And ultimately, at the top there of this diagram, it's about provider and patient experience. It's about building new adaptive processes and new care models and new other things. And ultimately, it's about health outcomes and supporting those. So those are some things, Scott, that we're thinking about. We haven't solved entirely, but something that we're charging towards and helping the organization to think through. So that's it for us. But thank you, Scott, and I'll hand it back to you.
Well, thank you. And I'm excited because there's such a great fit between what you presented today. And it really does, Michael, bring me up to speed. The last time we were together was in 2017 up in Toronto, and I got a snippet understanding of where you were headed. And so to get an update in 2023 here is fantastic. But this fits so well with what we've been covering in the Operational Analytics 101, 201, and 301, so to speak, over the last month or so. It's a perfect fit. And there's so many directions we could go with conversations at this point, because there's so many gems of wisdom. But the data literacy thing, which was the most recent thing you talked about, is so critical. I keep coming back to when we were out at Intel, their global supply chain group. The guy that did the presentation on Intel's analytics model, which we've used a lot, he had about 4 books that he really liked, and one of the books was Moneyball. And every once in a while I get that movie out. Brad Pitt's in it. I don't know whether you've seen it, but it really speaks to this issue of data literacy. And it was this slide, which is again such a super critical, this layer here, the people, culture, and data literacy row. Because I really do think that in most organizations, that is all of this is super critical in terms of moving forward with data and fact-based organizations. But that row in particular, I think, as you've highlighted, is very, very fundamental. And so I'll just say that and then have you react to it. But the other thing I'm struck by, Andre and Michael, is that even though you're in healthcare, I don't think that the model and the approach and the migration strategy that you're outlining is healthcare centric. I don't think it's healthcare specific. I think this is the type of approach that any organization I think should be considering and applying. Your thoughts on that?
Yeah, that's great. I can talk a couple of questions in there. The first, your comment around data literacy and the importance of the cultural change. And I think, and when I talk to my colleagues, across healthcare and other industries, one of the biggest challenges that is faced is that, we can sit and develop incredible tools that are data-driven, incredible dashboards, or incredible ways to see variation in a process, or incredible algorithms to prompt a decision or prompt focus for a manager or decision maker. But the reality is, if they're not embedded and they're not used and they're not part of the process and change a process to deliver, in our case, better care, then it's all for naught. And so to invest as an organization, to invest a ton of resources or all of your resources in, chasing the new tools and the new algorithms and the new dashboards and all those things, some of that will be wasted if you haven't invested in the culture, haven't invested in advanced the organization's ability to use the data for change. Because at the end of the day, that's where change lives. It's not within a new tool. You can't just throw it, as we all know, you can't just throw a tool over the fence and all of a sudden magically expect the process to improve. It's an embedding of the data and the analytics and the insight with the process and the people and the change. And those are two different spheres. And so we think about that often, and that's why we've actually launched, and Andre's launched, a data literacy program where we're trying to advance our organization in that space. And I see a question in the chat, and I see a few more, but one of the earlier ones around, how are you preparing your workforce with AI? That is going to be one of the biggest challenges over the next, I think, 5 years, because it's moving pretty. And since January 2023, it's been moving pretty quick with GPT. And how do you start to embed a human and machine beside each other? And that's a process design problem, and from my perspective. And how do you design those processes? How do you build those tools? And how do you measure the outcomes? And what are you trying to achieve? Mm-hmm. And so really, really, really important. I'll pause there. Andre may have some things to add.
No, Michael, I think you covered it well. Nothing more to add from my perspective. Thank you.
And, I was struck by, I really like this, one of the things that we've been highlighting, and Intel highlighted, it was a really, really key point when we were with Intel a number of years before we were up with you in Toronto, Michael. The storyteller thing, the being able to create aha moments with data and information, and the conversion of information into something that, again, literally speaks to you and just sort of screams at you. You look at it and you say, "Oh my God, I see things I didn't see before." It seems to me that this role is so essential. And yet, as Intel pointed out, developing somebody who is a good storyteller is a craft. It's a craft. Some people, maybe it could be nature nurture. Some people maybe are born with it, but for many people, it's something that evolves over a fairly long period of time. You've got to work at it. So what's your experience with finding storytellers or building or creating storytellers?
Yeah, it's a great question. So this is a fairly new role for us, maybe a couple of years in. So I'd say we're on the build side of things. I don't think it's necessarily an industry title, although I think we borrowed it from another industry. We saw it elsewhere and we thought, that's an interesting title, but knowing that this is what we want to achieve. So that's what data storyteller, and it's interesting for those of you who are trying to recruit and build talent. You may have a section on talent building. Having a creative name like that is sometimes helpful.
Yeah.
And the reality is, data is everywhere. Like if you think of all of our leaders and all of our managers and our workforce, they are bombarded with data, and so in part it's a curation exercise. So how do you have a conversation and curate and tell the story about what's very meaningful, because they have the data? And so how do you synthesize it and enable it and transmit it, for lack of a better word, in ways that are meaningful and impactful? The second piece, which I don't think is necessarily embedded in that slide, is around helping the organization and helping leaders in the organization define the problem. And that's often something that's a core to storytelling. And you can say, I can tell a story because I can put a great slideshow together and I can have nice visualizations and everything else. But if you've started on the wrong foot and haven't fully defined the problem correctly, or too big or too small or whatever it is. And so part of that storyteller's role is to work with the business and work with the organization to hone that. What problem are we trying to solve? And how do we bring data to bear to tell meaningful things about that particular problem that are are action orientated, meaning we see the problem, we can talk about the problem, and now we can go put a pathway forward to solve the problem. So I know that sounds very simple to us in the engineering space, but really that's a teachable, that's a build element. That's not natural and not necessarily, it lives in people's, in some places, but it's something that has to be taught widespread. And so we're embarking on that and certainly excited about it because we think it's critically important.
Yeah, that's Andre, jump in.
Yeah, I was going to say, Michael alluded to that in his last statement. So besides just recruiting externally, Scott, this is a skill that people have internally within the organization. We just need to bring it out. And so part of our data literacy initiative, we are focusing, helping people understand that there are 4 data literacy skills that they really need to have depending on their role. Data analysis, data interpretation, data storytelling or communication, and then data-driven decision-making. And so we have put together programs in place, in-person training versus e-learning, around helping them understand the principles and frameworks that can help them and support them in telling better stories. And as Michael mentioned, what would they need in order to gain that skill set within their particular role in the particular area of the hospital as well.
Yeah, yeah. Well, we could go on and on and on. Lots of great conversations we could have in dialogue. This has been a fantastic presentation. But I want to take just a couple of minutes and wrap up and segue for people into what's ahead. So before I do that, Michael and Andre, once again, I know you're both very busy, and I very much appreciate you being willing to take time to share with IISC's members and customers some of your learnings and wisdoms and experiences. It's been fantastic. Thank you very much.
Thank you.
So what's ahead is we got the schedule messed up a little bit, so we're going to go back and do 301 on the 18th, even though today was 401, so we get it out of sequence here. So if you're interested in registering for the third sort of principles and theory and methods, that's the link to register for 301, and then we'll start our We'll do operational analytics 501, the 3rd of August. Actually, I believe that's going to be it may be the 3rd of August. And we're going to talk about analytics tools, but we're going to segue into AI. So into the AI thing. You saw us doing that a little bit today because you almost get drawn into that conversation when you talk about data, in fact, analytics and decision support and benefits realization and so forth. So, and once again, there'll be a feature article in the ISE magazine early August that sort of capstones all of this. So look for that, those of you that are members. And then we'll start our AI mini series on the 10th of August. And then we've got some additional capstone senior design presentations that are just so fun to look at some of the great work our seniors in industrial engineering are doing around the country. In fact, they're one of the Toronto, used to be Ryerson, Toronto Metropolitan University, came in 3rd this year, Michael and Andre, in the North American contest for over 100 universities. So we're really happy with about that. So there's a short survey. Andre and Michael and I would like to know how we did today, how you valued it. Give us feedback in terms of things we can do to improve things. James Swisher, his email address is there. James is with full-time with IISC. He's the training director for IISC. If you have any questions or comments, feel free to reach out to James. And I'll stop there. And today was outstanding. Once again, Michael and Andre, thank you very much. And have a great rest of the week. And we'll see you soon.
Thank you.